The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. We are gathered here for the next episode of TMD Demystified. I am Tony Urbanic. Today's episode, I hope, will be helpful, fruitful. Today's episode, I'll give you the title in just a minute, but the purpose of this episode is for encouragement, truly encouragement about your participation in solving the TMD conundrum, the TMD dilemma. I stand by what I say, we can document what we say, and we have solved this problem. I'm still waiting for comments or criticisms and anyone who wants to disagree with the points that I bring out. I'm still waiting, and I don't know how long I'll wait till someone is going to be willing to confront me on some of these facts, but I've figured this out. Unfortunately, I fell into it. I did not intend, it was not my intention to develop a company, develop a patented device. My intention 12 years ago now was to see if I could figure out what no one else figured out. And today's episode is simply a little logic, a little information to encourage those who want to help us and help me solve this problem, this dilemma, this conundrum throughout the United States and beyond. It is a huge problem. I've said that many times before. It is a huge, huge problem. The deeper I get into it, the huger it gets. The more people that I find in our local area here in Middle Tennessee, in Nashville, in Brentwood, Franklin. And this problem ruins their life. And they go around and spend, or their insurance companies spend, or they spend thousands, in some cases, hundreds of thousands of dollars doing things that don't work, aren't effective, and they end up right where they started. And they're very frustrated. Some of them are very angry. Some of them have given up. And I have two people who have documented with me and sincerely said they actually thought about ending their lives because the pain was so severe and no one would give them any help. So this episode is just my take on trying to encourage a listener, whether you be general dentist, oral maxillofacial surgeon, or orthodontist or other, to help us solve this problem, which is solvable. The title that I picked out is going to be titled, "What If You Could Treat TMD as Easily as You Prep a Crown?" Obviously directed to my general dental colleagues. But if you are an oral maxillofacial surgeon listening, it would be entitled, "What if you could treat TMD as easily as you could flip out a wisdom tooth?" Or if you were an orthodontist, it'd probably be entitled, "What if you could treat TMD as easily as you could use Invisalign?" Just doesn't take much effort there. It is that easy when you really understand what's going on. Now, let me digress a moment. Recently, I was in a environment where, and I want to couch my words a little bit. I was in an environment where there was a dentist who was a, quote, TMJ specialist who gave his rendition of diagnosing and treating TMD. I was silent. I did not say anything in the room full of other dentists as this practitioner and TMJ specialist went on. But he actually wrote a booklet, and I'm not going to identify who he was. I don't want to embarrass him. That's not my point. But after he went on for almost 2 hours, I really, he's first of all, he spoke so fast I couldn't follow him along. I had difficulty. Maybe I'm slow. I really couldn't follow him along. He was speaking so fast, and so I decided he actually had a booklet about TMD that was produced for the public, not a professional. And so I bought his booklet, and so I could actually see if I could understand what his point of view was, because I generally know what the point of view is within our professions about TMD. I've talked on it, spoken on it many times before, but I wanted to just kind of nail this down for you because, again, my purpose is to encourage you, not discourage you. And what I find is that the so-called TMJ specialists want to make this problem complicated. And I swear to you, it is not complicated. I think I've talked on it many times before. We're going to cover it briefly, but it is not complicated. When you understand the simplicity of it, it all comes into view and you can treat it successfully. And we have documented that with over now 4,000 patients in an independent university study. So I'm going to quote out of this doctor's booklet that he wrote, a couple quotes, and then I'm going to kind of ask you, what do you think about it, or what's your experience in it? First quote, and I'm not trying to take it out of context, but the context is self-explanatory. He states, as I've said many times before, the problem with TMD is from the dental school and onward, everybody wants to make it complicated. And he says, first sentence, this paragraph, the temporomandibular joint, TMJ, is the most complicated joint in the body. That is not true. It is a joint in the body. It has a little different anatomy to it. It serves, several purposes where, your elbow serves several purposes. It can rotate and it can go up and down. It says, but it serves a purpose of swinging a golf club or a tennis racket or, a dog leash, all kind of purposes that the elbow services. Well, so does this joint. It has several things that it does. The second quote, but it's not the most complicated joint. It's just a joint. It operates like any other joint in the body. So if you understand that and you work from that point of view, then it's easier to then recognize the facts involved with temporomandibular joint problems. The second statement that he makes, again, I'm not interested in making a problem for this doctor, but he says, we previously touched base on the idea that pain isn't just a singular cause. Instead, it has a multitude of causes, which is the same for TMD. It is not just a single disorder. I beg to differ. TMD, and again, this is an effort by the profession or the specialists for TMD who call themselves specialists to make it really complicated. I will leave it to your discretion to decide why they want to make it complicated. I have my own opinion. I won't voice it. But they want to make it complicated, and it's not complicated. And he states it very clearly here. It is a multitude of causes. No, there is only one cause of all the symptoms, and that is inflammation. And any pathology book will clearly state that the cause of pain is inflammation. That is what causes pain. And if you can deal with the inflammation, then the pain will diminish. This is common sense. I was picking up my laundry, and I pulled next to a car. A gentleman was also picking up his laundry, and he had a couple bumper stickers on the back of his car. And I actually wrote both of them down. And one of them I'm going to share with you here. I did have to stop the gentleman, shake his hand, and I said, I totally agree. But one of the quotes that he had Doggone it. I had it right here in front of me. Oh, here it is. One of the quotes that he had that I just shook his hand, and I relate this to what I'm doing right now. Make the facts count again. Make the facts count again. It was a bumper sticker, but as it relates to TMD, that's what I'm trying to do. Make the facts count. So it is not factual that TMD is the most complicated joint in the body. It is not factual that, pain has a multitude of causes. The cause is inflammation. And I've defined that. I determined it for myself 12 years ago. We began operating with that, and we figured out how to make the inflammation go away by disoccluding the posterior teeth over a protocol, a longer period of time, using posterior disoccluding splint that you could talk with and just can't eat with it in your mouth. All right. So that's a prelude to really what I have to say today. So this episode, good or bad, whether you're going to stick with it or not, or you find it helpful or useless, I'm going to proceed because I really have a mission. My company has a mission. Those who are members of our company, we all share a mission, is to solve this problem as widely as possible. And we're building that, and we will be successful. So what if you could treat TMD as easily as you could prep a crown? Well, that is possible. So how would your practice change if you could treat TMD? Now, whether you took this challenge on as a major part of your practice or just a minor part of your practice, or you did it, just when the patients walked in, I guess that's up to you. I would prefer, like we do here, we use a very unsophisticated type of marketing awareness program that literally drives hundreds of patients a year. Actually, we get 13 new referral sources a month, and do roughly 20 to 25 consults a week, 4-day week. And our practice is growing. You may not want that kind of practice. I understand that. But what if, how would your practice change if you treated TMD? So let's talk about a few of these things, how they may relate to you personally, in concept of encouraging you to think about this, because we can prove this, that any of these things are possible. Would you enjoy your patients more? Dental patients, for the most part, are good patients. No one really enjoys going to the dentist, but some patients can be a problem. But I can tell you that TMD patients are much easier to enjoy working with them. And certainly when you make their symptoms go away, they are very gracious and have tremendous gratitude about what you did for them. It's very satisfying. I've spoken on that many, many times. Again, I'm trying to pull this together for you to think about how you can participate and why you would want to participate in this treatment protocol program. Would you have more time with your family? That is the biggest complaint that I find and I hear about with my dental colleagues who are strapped into a practice of one kind or another, and that they don't have the time that they want to spend with their family. Treating TMD is not time consuming. All right, let's dive into that just a little bit. Again, my experience with my colleagues who are, quote, TMJ specialists is that it's very time consuming. In fact, so time consuming, I have gotten written reports one way or another, or been asked to review reports from TMJ specialists that go on for 30, 40, 50 pages. No, an exaggeration, not hyperbole, just writing the report or checking off the boxes. Some of them are, just multiple boxes, but, it's not necessary, not at all, but it's out there. I'll give you my opinion on why that is out there. Again, like it or not, that's the practitioner's justification for gaming the insurance companies. You got to have a big report to sound important. Not true. Again, no one can smooth me. I have the dental degree, I have the medical degree, I have the academic degrees, and I know what's happening. We talked about more grateful patients. Would you like to have a load of grateful patients? And believe me, they're all grateful. Some of them express it more than others. Some of them just shake your hand. Some of the ladies say, "Can I give you a hug?" I've had husbands ask to shake my hand when their when their symptoms go away. I've had several women say, "Thank you so much. I know I'm a much better mother now because I'm not on this chronic pain." I've talked about how just during the consultation, when we get to the point where the patient looks up at me as I go through the consultation and understand their symptoms, literally go down the symptom list, and they check off, "Yes, I have that. Yes, I have that. Yes, I have that. Yes, I have that. Yes, I have that symptom." And they look at me and they'll say something like, and some exactly like, "You're the first doctor who seems to understand this problem." And they start to cry, literally, because I haven't even offered them the solution yet, but just having someone understand it in their presence makes them tear up. And this is not one-off. I see this not infrequently. After 4,000 or 5,000 consults, you get to see it all. Would your back hurt less? We have several doctors who are in the network who are actually, their goal is to either bring on an associate or sell their practice and do nothing but temporomandibular joint services. And you're not crouched over a dental chair. And I know from experience, certainly at my age, a lot of my colleagues that came into the profession with me at my age had to bow out early because of back and neck problems, well known in the profession. And that's a big advantage of treating TMD patients. It doesn't take long to treat a TMJ patient either. I didn't think I fully covered that. I mean, really, consultation, delivery of the device, and then follow-up appointments, whether you do 3, 4 follow-up appointments, it won't take any longer than an hour. When you really get experience with it, the whole thing will take start to finish until you discharge the patient and say, return PRN if you ever have any trouble, is 35 to 45 minutes. Consultation, 20 minutes, and then the rest takes care of itself. So it's not a long, difficult procedure, and certainly remunerative. So if you can get out of the habit and the problem of the physical limitations that are put on dentists, I know it's a hard profession. I've spent my life, communicating with my colleagues. And so treating TMD offloads that part to you quite a bit. Would it be, would you be able to retire earlier? Yes, you would, if that's what you wanted to do. What's your definition of retirement? Well, I'll give you a little, in my own world, in my world, when one is doing exactly what he wants to do, he's retired. And so if what you want to do is play golf, 5 times a week, well, then you need to play golf, 5 times a week, and you're retired in that sense. And if you just want to sit on the front porch, that's okay too. You're retired. Well, in my world, I'm doing exactly what I want to do. So in my definition of retirement, I'm retired. I only see patients 1 day a week on Mondays, and my associate sees the TMD patients the rest of the week. I am very, very busy as running the company, TMJ Services, president, CEO. That keeps me busy, but I'm enjoying it thoroughly. I'm doing exactly what I want to do. So in my mind, I'm retired. In the net usual sense, no, I don't sit on the front porch and I don't play golf. I fly airplanes, but I am not retired in the usual sense. But you can retire early because there are lots of TMJ patients to treat. As I've indicated, it is a huge problem. 45% of females have TMD problems. Would you be able to hire an associate? Well, I've shown that you can do that. And we have a practice that is so busy with TMD, my associate does the lion's share of the work. And I get to spend my time running the company, but that is definitely a possibility. Would you develop increased referral services? In other words, would you build your practice treating TMD? Well, that is a definite yes. And I've spoken on this before, but we have proven that, when you successfully treat a patient who has had 5 years, 10 years, 20 years, 30 years, and the average person we see here in this practice in Middle Tennessee, average, has had between 15 and 20 years of these symptoms: headache, earache, jaw pain, neck pain. I won't go on to bore you, reel them all off at the same time. 15 to 20 years of this without successful resolution. And when you do resolve those symptoms for them, they refer in their friends, they talk about you. Well, you are their favorite doctor. If you are a general dentist and they come from another general dental practice, or they don't have a general dentist, they want you to be their general dentist. If you're an oral surgeon, they want you to take out their kid's wisdom teeth. I see it all the time. I don't do oral surgery anymore. I finished up my practice doing some office surgery. Most of my practice was in the operating room, but I finished my practice doing the usual teeth and titanium. And a lot of the patients that we treated wanted to send in their kids and their family members for dental implants and wisdom teeth. It's a practice builder. And you definitely get referrals from other practitioners who want to send these patients with these compromised symptoms. And you'll get patients, and we get patients from PCPs, PAs, nurse practitioners, immediate care clinics, chiropractors, physical therapists, massage therapists, my dental colleagues, my oral surgery colleagues here in Middle Tennessee send me a boatload of TMD patients, ENTs, neurologists, and I've even broken into the Vanderbilt system. We have Vanderbilt doctors who, once you get in the Vanderbilt system, the whole system kind of feeds on itself. But in our case, we're starting to get patients from the Vanderbilt system itself. It's a huge practice builder. Would you have more consults than you can handle? Yeah. Yes, you will. If you promote it, if you use the marketing program that we offer, which is an awareness program to the medical profession and your other dental colleagues, but especially the medical professions. They're the ones who see all these symptoms, and you will have eventually more patients than you can handle. Do you want that? That's for you to answer. Would you make more income? That's a definite yes. That's a definite yes. The average fee, because I looked into it, and this is data from 6 or 7 years ago, the average fee for non-surgical TMD treatment throughout the United States of America is $2,000. And that's average. East and West Coast, much more. Certain parts of the country, much more. And I'm not really interested in quoting fees, but just gives you something to work with. Would you enjoy your job more? And that's a definite yes, at least in my case, my associate's case for sure. The other doctors who are in the network, let them each speak for themselves, but the ones I've asked that question to, the answer is yes. for sure. Would you work fewer hours if you wanted to? If you take my lead, if you're not going to run a company along with treating TMD, you can just see patients 1 day a week. It works. That would work for you. And finally, would you be happier? Well, happiness is hard to define. What is happiness? I'm not going to try to define happiness here for you. That is not my intention. But in your definition of whatever happiness is, would you be happier if you had a more substantial income, if your patients had more gratitude, if the physical part of it was easier, if you decreased your workload and increased your referral sources tremendously? That is, I touched on that. The referral sources increase logarithmically at some point, and we continue to get on average 10 new referral sources a month. Last month we had 13 new referral sources, and now have a list of over 790 some, approaching 800 separate referral sources here in Middle Tennessee. The majority of those now becoming out of the medical profession, not the dental profession, although probably it's 55% medical, 45% dental referral sources at this time. But I see that we're gaining ground significantly on the medical community because of the awareness program that we have substantiated, and send out letters to prior doctors, all prior doctors that patient has seen, substantiating what their symptoms are and what percentage of their symptoms are gone. And that stimulates these doctors to send in more TMJ patients that they uncover and now know how to diagnose. So these are words of encouragement. If you'd like to participate, we encourage you to do that. But if you're not interested in delving into treating TMD, at least believe in your own heart, in your mind, in your experience, that is not a complicated joint. It is not a complicated treatment. It is all about inflammation within the joint. If you can handle inflammation, non-steroidals handle inflammation really well, but only for 2 or 3 weeks. And if you take it beyond that to a certain point, to a certain degree, you'll end up with liver problems and others. But if you unload the joint long enough, the inflammation will die down without any drugs, without any surgery. And we know how to do that. And that is my purpose here, is to teach you how to do this. All of this information starts on our website, and then goes into the course that we offer, the online course of how to do the device, how to use the device, the nuances of the device, the Urbanic device and protocol. Once you take the course, then you are licensed to do the patented device. And then all of the information that goes along with all aspects of treating patients are included in this podcast and on the multiple episodes that encompass the podcast. I think we're on episode 89 or 90 currently, and they all cover good material. So this episode was simply for encouragement, for you to think about how you could change your circumstances, and it's encourage you to do that, and to discourage you from thinking that the temporomandibular is so difficult to treat. It's such an unusual joint. It is not, and it is not difficult to treat. I stand by that. For today, I appreciate your listening. I look forward to the next time I can speak with you, which will be in a week. I have several other topics lined up, and I hope that at least those who do view it and stick to the end appreciate what I'm doing. I'm Tony Urbanic, and this is TMD Demystified.